So here is an example of an anterolateral ligament injury. The anterolateral ligament has been considered to be important in anterolateral stability of the knee joint, and it is a ligament that runs from the tibia just posterior to the about a few centimeters, centimeter and a half posterior to the Gerdy's tubercle where the iliotibial band attaches. So we go a little bit posterior and you can see the femoral attachment of this anterolateral ligament. The slender band of the ligament extends and produces two discrete bands. One extends to the lateral meniscus, which is over here, and the second one extends more cranially and actually is supposed to go and attach to the blends partly with the fibular collateral ligament and also attaches to the femur. And in this case, what we see is the tibial attachment looks intact. You can see the slender band that extends towards the you can see the slender band here that extends towards the lateral meniscal attachment, and then here you can see the more distal proximal attachment, which should be at the femur, which sort of is just hanging out in space and waving around. We also see a lot of soft tissue edema in this region, which would confirm that somebody has sustained an anterolateral ligament injury at its femoral attachment. I should warn you that this appearance is often seen in patients who do not have any symptoms and who may not necessarily have a tear. The femoral attachment of this ligament itself is very attenuated looking normally, and so be very careful when you're calling this, but this would probably be a good example of a femoral attachment anterolateral ligament injury, which is probably real. The effect on instability itself is questionable. I suspect that's more related to the actual fact that there has been some anterolateral capsular disruption rather than just this ligament itself.